Okay, good afternoon, everybody. Welcome to our second governing body meeting being held in public this month. I'm Terry Hudson, I'm Chair of Sheffield CCG. The purpose of today's governing body is to take us through our statutory responsibility to present our annual audited accounts and also reflect on our annual report in public. And those are the two main items that we've got for our agenda this afternoon. I've received apologies from Brian Hughes, Judy Thorley, Ben Allen and Greg Fell. And a note that there are some people that will need to leave today's meeting at 3 o'clock promptly. I can confirm that we are quorate and we are okay for the meeting to proceed. Before we proceed with the meeting, are there any members that have got items and declarations of interest beyond what is registered in our declaration of interest register? Okay, I can't see any hands up. Kath, can I confirm with you that we haven't received any questions from the public today?
No, we haven't.
No, okay. So in addition to our usual governing body members, we've a number of staff that are joining us from different parts of the CCG, and indeed some people who are joining us from partner organisations. So welcome everybody who's come to governing body this afternoon. It's really good to have you here, and we look forward to hearing from you later. It's just also worth noting that today is likely to be our final governing body in public. We may hold a final meeting in June, on the 30th of June, if there is any urgent business that we need to take in public. Otherwise, today's meeting will be Sheffield CCG's final public meeting before the ICBs come into force from the 1st of July. So I'm going to move us now on to item 5 on the agenda. That's paper A, which has been circulated, and it's the adoption of NHS Sheffield CCG's audited financial accounts. And over to you, please, Jackie.
Thanks, Terry. So I'm Jackie Mills. I'm Director of Finance at Sheffield CCG. So if I start with an apology for the late circulation of this paper that was only emailed to governing body members this morning, but is now live on our internet site. Unfortunately, despite having our sign-out meeting with KPMG as our auditors on Monday, they weren't able to provide us with their draft report on the accounts till 10:48 p.m. this last night. Chris Cotton, as Deputy Director of Finance, obviously was working late into the night early this morning to make sure that we had a report to bring to both the Audit Committee this morning and to this meeting. So I do recognise that people probably haven't had time to go through the report, so therefore I will take you through the report in detail today to make sure that we give it due attention. After I've done that, I will ask Anthea to outline the discussions that we had at Audit and Integrated Governance Committee this morning and the recommendation coming forward from that meeting. So if I just take you through the terms of, in terms of the report, members will recall that you received a draft version of the annual accounts on the 5th of May. These included an explanation of the statements and the key information contained in the report. So hopefully that allowed you at that point to have a good understanding of the issues that were in the accounts. I can confirm that KPMG have completed a substantive part of their review of the accounts. An Audit Committee this morning received a draft report from the auditors on the key findings. And whilst there are still a few areas that require some further testing, they did confirm they've concluded their value for money work and confirmed there were no significant weaknesses in our arrangements. And they also expect to be able to issue an unqualified opinion on the financial statements ahead of the final date of submission of the accounts to NHS England later in June. So I'm pleased to report there are no substantive changes proposed to the draft accounts that you have already seen. As set out in section 2 of the report today, there is a minor amendment to note 4.2, which just changes the value of average number of people employed for the year. There is a presentational issue that we're still in discussion with the national team about presentation of an exit package. It's been confirmed that the way we've shown it in our accounts is correct and in line with the national guidance, but there is an issue about how the full exit payment is shown over a range of CCGs. So we're still in discussion with that. If we have to change that, it won't make a material impact on the accounts. It will be a presentational issue. But if we do propose to make any changes, I will make sure that that's signed off with Anthea as chair of the audit committee ahead of any change. I think they are the main things. So substantially no changes from the accounts that you have already received. To date, subject to the finalisation of KPMG's review work and assuming no subsequent guidance from NHS England ahead of the final submission, I don't anticipate any changes to the accounts. So Anthea, are you happy to take on feedback from the discussion this morning?
Yeah, thank you, Jackie. And so Audit Committee did meet this morning, and we hadn't had a long time to review the papers before the meeting, but we did meet, we did go through the papers in some detail, both with KPMG, who presented their draft final report, which is called the ISA 260. We've also taken the time out between the meetings, between Audit Committee and governing body, so that we did spend some quality time with the numbers, just going through them to see if we've had any questions. And I confirm that all members of Audit Committee who were present this morning have written to me and said they've got no further questions on those reports. So we have done that check, not in the ideal order, but in the best order that we were able to do it in today. I too have been through the papers as well, and I'm happy with the numbers we've gone through. There's been some processes that we've gone through, which I'm sure Jackie will go through, the final sign off and how we are going to get those agreements and get the final papers of the versions of the audit as well. But it's been time pressured, but a clean audit. There's one recommendation on controls, which is common across every CCG who uses the same accounting system as us. And I think we are probably one of the lower risk people who've got that, because we've got some other mitigating procedures in there. The finance team have done an absolutely sterling job in, okay, it's our third year end now, so we know how to do it remotely, but we've had team pressures and changes in the year as well. And they have done really well to work through the night, literally getting these papers out to us today. So I would like to thank the team, make sure that is thanked on and hopefully passed on by governing body if they also agree. But certainly Audit Committee recommend these papers for approval.
Thanks, Anthea. So if I just outline next steps and then I'll open up for any questions, Terry, if that's okay. If governing body is content to agree adoption of the accounts and to approve that Gavin signs the letter of management representations, just to note that the letter that's included in this pack is noted as draft. The auditors confirmed this morning that they don't expect that to change, but we will make sure that we confirm that before we ask Gavin to sign it. Again, if the letter substantially changes, we will talk to Anthea first about the implications of that. There will be just that final bit of testing work and an issuing of the final ISA 260 report by the auditors ahead of the submission on the 22nd of June. One of the things that they will need to see is that our final ledger position at the end of, before the 22nd of June is as set out in our account. So it will be a final test. Subject to agreement of governing body, we'll sign off the accounts, we'll sign the letter of management representations. If there are any issues that come out through the final testing or through any changes in guidance from NHS England that will have an impact on our accounts, I'm asking governing body if they are happy that I initially agree that with Anthea, and if Anthea agrees that there are substantial issues that need further consideration, either of audit committee or governing body, we will convene an exceptional meeting to consider that. That is our backstop and an exceptional arrangement, and I don't expect to have to use it, but it's just we need to agree how we would deal with any changes that might be required. So Terry, I think, again, hopefully that takes people through. I think because we're not asking or noting any significant changes from the accounts that people have already had time to review, I'm hoping people are content with that and the recommendation from Audit Committee.
Okay, thank you. So I'll open up to any questions from governing body at this stage. Okay, I think that has been delivered in a clear enough way, Jackie, that there aren't any questions. And as you say, there's no significant differences from the accounts that we have seen previously. So if I just take us back now to the recommendations to governing body, the first one is to note the verbal update that we've received from the chair of Audit Committee. Thank you, Anthea. Update has been noted. We're being asked to approve and adopt the draft final audited accounts. So can I check with governing body you're all content to do so? Okay, not seeing any objections. The second point is to approve the chair and accountable officer sign the letter of management representation on behalf of governing body. Again, can we check that everybody's happy with that approach as usual? Thank you. And then finally, is to delegate any responsibility to the chair of Audit and Integrated Governance Committee, so Anthea, to approve any changes required to the accounts before submission. So again, can I just check we're content to take the approach that we would usually do there. So that's concluded that item. Thank you, Jackie, and big thanks to the team, and particularly noting Chris has really been up late into the night. I'll drop Chris a note of thanks, but if you could share our thanks from governing body with the wider finance team. You all always do an amazing job at this time of year. It is extremely pressured, but you know, without this we wouldn't be able to function. So big thank you from us. Mark, hand up from you. So could I bring you in, please?
Yeah, thank you. I'm Mark Gamster. I'm the Deputy Chair of the Clinical Commissioning Group and a lay member on the CCG. Chair, if it's okay with you, I think now is probably the right time just to raise this matters arising issue with regard to finance, given that we've just concluded the finance item. What I just wanted to get clarification for was and particularly given this is the likely to be the last meeting in public of this Clinical Commissioning Group. At our last meeting, in the private part of the meeting, we talked about the financial plan update for 22-23, which presented a challenging picture to us in the sense of going into the South Yorkshire integrated care system is going into a position, which I understand is still being worked on, but facing some considerable financial challenges. And obviously, what I'm concerned about is that is to understand when the issues that we discuss there are going to go into will be discussed in a public arena, in a public meeting, because at the moment they've only been discussed in a private meeting. But secondly, one of the things that was flagged up there was that the ICB non-recurrent allocation for health inequalities funding, which is of the order of 5.3 million. Looks like it's been absorbed into addressing the good. Gavin's shaking his head. So, but in the table it says that no funding is going out from there specifically for health inequalities in the table that we discussed in the private meeting. So again, I think it would be good to understand precisely what that means, because in the report that we accepted in the private part of the meeting, that's how that information was presented to us. So I think it's really important, and this is clearly, particularly at the moment, given the pressures that people are facing, particularly those experiencing health inequalities, it's really important that we're clear about this and public about our discussions.
Okay, thank you for that question. Gavin, are you able to respond to Mark's inquiry there?
Yeah, so I think the first thing I would say is, clearly there is a financial challenge facing the system, and obviously, as the CCG hands over to the ICB, there's a significant challenge within Sheffield CCG. I think the position is potentially significantly better than the last time we spoke, in the sense that there has been some additional national funding announced, which basically reduces the residual deficit that was included in our plan submission a month or so ago by half. It is conditional, though, upon the system, all of the partners, the provider organisations, the CCGs, etc., in South Yorkshire, to closing the balance, so getting to a balanced plan. So I think we're in a better place, but we've still got work to do. The specific point around, I'm not sure, Mark, whether I was at that private meeting or which table you were referring to. But
yeah, you were there. You were present. Okay,
well, I'll take your word for it, Mark. But my point would be that addressing health inequalities is one of the fundamental aims of the ICB. So we won't be disinvesting in addressing health inequalities. So I don't recall the table you're referring to, Mark. But that's our position. I mean, it's a priority, and that's not what we're doing. So I'm not sure what how that was presented or what lay behind that, but that's our position. I'm happy to put that on record.
Okay, thank you, Gavin. Jackie, would you like to come in?
Yeah, just in terms of that last point, Gavin, I can pick that up with you separately, just in terms of where that interpretation came from. But in terms of your first question, Mark, which is the next steps for the financial plan. So just to remind members that at the beginning of March, you did approve the budgets for the 3 months, April through to July, for the CCG. So for the period that the CCG will exist. It's been confirmed by NHS England that the CCG will receive the resource limit that is equal to the actual spend that we incur for those first 3 months. So in effect, the governing body of Sheffield CCG has signed off a balanced plan. However, the plan for Sheffield as a place for the full year is still showing a significant level of financial challenge. And as the rest of the NHS is, as we are adjusting, coming out of COVID, moving from a financial regime that covered a significant amount of additional costs, getting back to a more recurrent level of spend. So there are quite a number of challenges in there in terms of being able to reset our levels of spending to a more normal level. And as Gavin just informed, we have had additional funding that's been allocated to help manage some of that, but hasn't mitigated the full level of financial challenge. So we're still working through what that means for us as a whole system and for us as parts of that whole system as well, and that piece of work hasn't concluded. So there will be, once we've worked through that, there will be a presentation of the financial position in public. I would expect probably early on, Gavin, in terms of an ICB board meeting. So it's not that it won't come back, it will come out in public, but we're still working through a level of detail.
Just to add that, I mean, the first meeting of the ICB in public is on the 1st of July, which is the very first day that we're constituted as an organisation, and part of that discussion will be an update on the plan that we begin with. So that will be in public.
Okay, thank you, Mark, for the question. Thank you, Gavin and Jackie, for qualifying the responses there. Okay, final bit just on finance is just a reminder to all governing body members that we are required to sign an audit declaration in relation to the account. So I know a number of people have already done those, but if the remainder of governing body can do that today and get those back into our corporate secretariat, just to confirm in writing to the auditors that we have seen those accounts. Okay. Right. I'm going to make a short change at this point to the agenda, as we will be taking items 6 and 7 as one item. And I'm just going to skip us down to reports circulating in advance for noting. There's the annual reports, which Kath is going to run through in a moment, so I won't take any comments on that, as we'll do that as part of the item. The second paper, just item 8.2, which is the draft constitution for the ICB. Just want to give governing body an opportunity if there's anything that you wish to raise on that at this point. It's come here for noting, and I'll just confirm with Gavin that it will be the 1st of July where the constitution will be formally adopted by the ICB in public. So yeah, Gavin's nodding away there for us. So it is here for noting, but in public, if there's anything anybody wishes to note at this stage. Okay, can't see any hands going up. So I'll move us back now to item 6. So I'm going to hand over to Kath Tilney, who's going to give us a brief introduction to the annual report, and then we'll move into item 7 seamlessly, if we may, Kath.
Thank you, Terry. So I'm Kath Tilney. I'm the Associate Director of Corporate Services in the CCG. And at the last governing body meeting in early May, I presented the draft annual report for 21-22, and today I'm presenting the final version for approval. And as Terry's just said, it's in the supporting papers because it's a very big document. I wanted to start off by thanking the members of the finance team, corporate services and the comms team and other parts of the organisation for the hard work and contributions for putting together what's a really good solid report. I particularly want to thank Carol Henderson, who's our corporate governance manager, who has worked really hard to manage this process and produce particularly the annual governance statement that sits within this. We had hoped that she'd be with us today. Unfortunately, she's not very well, so she's not been able to join us. There are a number of just a couple of small changes from the version I shared with you last time. The performance figures are updated up till the end of March. There are trade union facility time figures that have been provided that weren't available at the last governing body meeting. And we've strengthened the counter-fraud arrangements report area to reflect the counter-fraud function standard return. And finally, all the page numbers are now sorted because that's the kind of thing you do right at the end. So Carol went through that with a fine-tooth comb. Jackie referred earlier to the reported exit package, and depending on the outcome of that, there might be a small tweak in the remuneration section of the report. The report includes the final Head of Internal Audit opinion, which has been issued since the last meeting, and I'm pleased to say that that provides significant assurance to the CCG. As Jackie confirmed earlier, we're awaiting the auditor's report, but we don't anticipate there to be any significant issues coming from that. We discussed this version with Audit Committee earlier today, so I'd just like to ask Anthea to confirm if the Audit Committee would recommend approval to governing body.
Thank you, Kath. Apologies, I should have said earlier that I was Anthea Morris and I am the lay member for Audit and Governance, which is why I'm being referred to in this meeting for comment. So Audit Committee did meet this morning and we were happy with the annual report and want to recommend its adoption to governing body. Please, the final version. Thank you.
Thank you. Thanks, Anthea. So as Terry mentioned, in the next section of the agenda, we're going to introduce the staff, and we have a special guest with us today. We'll move on to that section so we can do the business now. And Terry, I'll hand over to you and you can lead through what we need to do. Okay,
so governing body's been asked to approve the annual report. It has been to governing body in various iterations. We've heard from Anthea that Audit Committee is recommending that we adopt the paper. So before we go on to hear about some of the specific items in that in more detail, can I confirm with governing body that you are all happy to formally adopt the annual report? Okay, thank you. So that's the business part of the paper done. I'll hand back over to Kath. What we have done over the last couple of years is rather than us receive the document as written, we've really liked to hear from people on the ground, people out in communities who are able to tell us about the impact and some of the work that our CCG is having. And as Kath said, we have a number of additional guests on the call this afternoon, and each of them are here to present some of the things that we've worked as an organisation, and perhaps we're particularly proud of the impact that it's made. So we've got 5 small presentations to receive, and if I may ask governing body to hold any questions and comments until we've heard all 5 together. So I'm going to hand back over to Kath, who's going to take us through all of those items. Thank you.
Thanks, Terry. So the annual report not only showcases how we performed during the past year, but it also looks back at some of the achievements of us as a CCG from 2013 onwards. I'd now like to introduce to you a number of members of staff from the CCG and a special guest that we have from the African Women's Health Group. And they've been invited to showcase what their particular teams have been involved in and the outstanding work they've achieved. Within the annual reports, we have some headline areas. So I'll start off with the first one, which is around Sheffield being the top core city for vaccination delivery and for flu vaccination rates, and introduce Richard Cosby, who's the head of practice support for medicines management team, and Karen Danvers, who's a senior programme manager in primary care development.
Thanks very much, Kath. I'll kick off with COVID and Karen will follow with flu. So as you say, the key thing that we want to celebrate is being the most vaccinated core English city for first, second and third doses of COVID vaccine, and that we've worked hard through the programme to minimise health inequalities. And we've achieved this through optimising delivery and options to access vaccine, combined with a comms offer to encourage uptake. Delivery was optimised by harnessing the enthusiasm of primary care and facilitating their creativeness, and also by standing alongside them to manage and mitigate frustrations. We created a mixed model for delivery and access, considering health inequalities with respect to where we put the sites and how they're accessed. As a result, patients can access vaccination through their own primary care network, or often at their own practice, at the 17 community pharmacy-led sites across the city, which are concentrated in areas of deprivation, at the mass vaccination site, or at one of the many pop-ups. All eligible patients have been invited in and given the option to book a slot, but there was also an option to turn up and be vaccinated at one of the many walk-in sites. Some of these were high profile, like you probably all remember the Crucible. Many others were in churches, mosques, shopping centres, including the Moore Market. These are also complemented with a free taxi offer, so that any patient across the city could book a taxi to one of the vaccination sites to be vaccinated. Alongside delivery, to encourage uptake, we work with the comms team in the CCG and at the council, and many community groups across the city were funded to produce and disseminate messages that were suitable for the diverse communities in Sheffield. There was also an extensive campaign, and we featured on TV, radio, social media, including messages from healthcare professionals from a BAME background, or for example, who'd been vaccinated while pregnant. The final area, I think, for celebrations is a response to Omicron just before Christmas, where the city stepped up to vaccinate over 11,000 people on our busiest day, and that saved many lives and hospital admissions. And we wish to thank everyone who worked with us to make this such a success. And now to hand over to Karen Danvers, please.
Thanks, Richard. So alongside the COVID, Sheffield doing the flu, we increased our flu uptake in the year 2021, and then we supported practices to continue to build on that for the year 21-22, which did result in us being the highest vaccination rates we'd ever seen, and achieve the top vaccinated comparable core city across the 3 biggest areas, which are the over 65s, the under 65s at risk, and the 2 and 3 year olds combined. So again, for flu, we worked with PCNs and practices to support co-administration with COVID wherever possible. Also supported them to vaccinate early where they had flu stock and co-administration wasn't possible, so they weren't waiting. So we made this happen in a few different ways. We worked close with networks, we utilised STH to support the housebound vaccinations, we supported substance misuse patients to access, we did extra work with the LD and SMI patients, tried to make sure that vaccination was accessible for all. So we're not resting on our laurels, we're still pushing to improve further this year and including plans for increasing the long-term conditions percentages, particularly around liver patients and 2 and 3 year olds, because these groups have the poorest outcomes if they contract flu. So we've still got more work to do. So great success in primary care on what they did, but we know there is still more that we can do. That's mine for flu, thank you.
Brilliant. Thank you, Richard, and thank you, Karen. Next, we're going to move on to special educational needs and disability support in Sheffield is improving. And we have Sapphire Johnson, Head of Commissioning in Children and Young People and Maternity Portfolio, Pippa Lord, Commissioning Manager, and Michelle Racy, the Designated Clinical Officer for SEND.
Thank you very much, Kath. Good afternoon, everybody. So Kath's very helpfully introduced us all. I'm Sapphire, I'm the Head of Commissioning, but I'm going to hand over to my team in a minute because they are the ones who have put in all of the work to make the significant improvements in our special educational needs and disabilities provision within the city. So it has absolutely been a team effort, both within the CCG and working with our local authority and hospital providers to deliver these improvements. Pippa joined us last year and is now taking a lead on the SEND commissioning. Michelle, bless her, has been with me for a few years now working through this and has absolutely led this from the front as a really visionary, enthusiastic, driven clinician who has really helped to bring these improvements along. So I'd like to hand over to her now to talk to you a little bit more about what we've done.
Hi, so I'm Michelle Racy. Most of you have met me before. I'm the Designated Clinical Officer for SEND. What that means is that I've got a statutory duty to help the CCG and deliver in its commitments to improve outcomes for children with special educational needs and disability. So, as many of you might know, that we had an inspection back in November 2018. It wasn't pretty. We ended up with 7 areas of significant weakness across the Sheffield systems for services that supported children with SEND. And these included a lack of citywide strategy, poor communications with our public around SEND and everything SEND. We had poor strategic oversight by the CCG, particularly the CCG. We had poor joint commissioning arrangements for children with SEND. The timeliness and the quality of EHCPs were really poor, actually, as were the system approaches that should enhance the quality of EHCPs. There was difficulty in identifying and meeting need in mainstream schools, and there were also challenges around the multi-agency transitions for our young people 16 and above in particular. So given the diverse nature and complexity of these issues, it was a huge challenge to succeed in improvements. I can now say we did it. I'm going to get a bit teary now. So, and that's with thanks to the local authority and their unfaltering commitment, the commitment from our CCG members, especially Kate Cleave, Sapphire Johnson, Danny Hides and her team, and especially our providers, to continue with improvements in light of the pandemic and keeping children safe was commendable. We had our revisit in February 22, and we succeeded in making sufficient progress in 6 of the areas. So yeah, well done everybody. We now though have an issue around transitions. We need to prioritise that, and we've now got an accelerated action plan that we have to report back in with improvements between 3, 6 and 12 months. So all of our attention is indeed going on to that particular area. There's still more to be done as well in the 6 areas that, although we succeeded in, we have to continue our improvements and to the best outcomes of our children across the city with SEND. And the improvements were only made really due to the better partnership working across the organisations, to include our Sheffield Children's Hospital colleagues, our colleagues in the Sheffield Teaching Hospital, our Parent Carer Forum, the council, and we're now more of a family, and really that's the only way to get things moving, and that's one of the lessons that we've all learned, I think, you know, going along this journey. We've got to act as a family, speak honestly and openly to each other. We, as a CCG, we've managed to increase engagement and the capacity within the CCG to meet our statutory duties, and that includes myself, who had to, we moved that to full time. I was previously 2 days a week. We now have a children and young persons clinical director who's fully engaged within SEND, and is really helping us develop our supportive systems across all of the networks. We also have additional posts to develop health input into our educational health and care plan assessments, and we're also developing the roles that are aiming to support children with evolving SEND. So it doesn't just stop at the kids that have got EHCPs, it's all about trying to prevent kids getting EHCPs in the first place, and that's quite a big challenge, but we're managing it quite well. We've also got large transformational programme led by Sheffield CCG in partnership with the council and with the PCF, and Sapphire's doing a sterling job in leading on that, around the neurodevelopmental and transformation programme, and Hattie, one of our other commissioning managers, she's leading on the speech, language and communication transformation plan, which again is quite a significant piece of work. And we've also already received investment for the health needs and education, and that's extra special to my heart, because what that does is support children across our city who have health needs to get back into education or to continue in education in a really positive way, and where we can prioritise and optimise their abilities, which, you know, that's always great to achieve that. So our next steps are to work with the ICS to ensure that SEND is embedded with everything that we do, because it impacts on everything we do. You know, these kids don't stay little forever. They grow into beautiful adults where we allow them to. And that's it from me. Pippa, have you got anything extra to add?
I think you covered it beautifully, Michelle. Thank you. I suppose as well, just to add, and moving into the ICS world, is that we're looking forward to, you know, continuing to develop our good relationships with our SEND colleagues in the other areas across South Yorkshire. We've got some great working relationships with them, and it's going to continue moving forward. So thank you for your time.
Thank you. And I just really briefly like to say a big thank you to the senior leadership team within the CCG as well. When we had the first inspection, I think I was something like 6 weeks into post, and it was a little bit of a lonely place to be. But over the last 3 years, the support we've had from the executive team, the governing body, we've been to speak on several occasions, as Mark will know. It's been really, really helpful. And when it came around to the re-inspection, we felt as a team very much supported by the organisation, that SEND had much more of a higher profile within the CCG, and I know that, you know, there's been a concerted effort to change the culture around that. So thank you very much for your support.
Lovely. Well, thank you very much, Sapphire, Pippa and Michelle, for that. The next item, or the next headline we're moving on to, is that Sheffield nurses were recognised in national awards. So I'm going to hand over to Jo Watson, who's the lead primary care development nurse, and Rachel Welton, the patient safety lead, for this item. Rachel, you're on mute.
I was so organised then. I started and just completely forgot the mute bit. I'm so sorry. I hope that doesn't cut into my 3 minutes. Right. Okay, here we go. Thank you very much, Kath. So I'm Rachel Welton. As Kath says, I'm the patient safety lead, but I nominated the primary care development nurse team because at the time I was their line manager, or the line manager of some of them. So thank you. So I'm going to go first and then Jo's going to come in. So thank you for the opportunity to share about the primary care development nurse being awarded a Chief Nursing Officer Silver Award. The team were presented with their award last year by one of the CNO's deputies. As I say, I nominated the team as their senior nurse, having led and line managed some of the team members for the previous couple of years. When I first joined the team, both I and they felt that the team were quite invisible to much of the CCG, plus the wider system, as there isn't a similar team anywhere else within South Yorkshire. Because of this degree of invisibility, there wasn't necessarily a good understanding of what the team does, and importantly, how it contributes to the CCG's priorities and what its successes have been. As well as not being very well widely known, the team also didn't feel very valued. Over the years, the team had been reviewed a number of times as part of reorganisations and were often referred to as a luxury, as they were about service and quality improvement rather than providing any statutory functions. I saw the fantastic work they were doing and wanted this to be recognised, as well as used their being awarded the award as an opportunity to promote the team and its value, including how it can work with colleagues in the future. So the role of the team is to improve patient care and outcomes and reduce unwanted variation through upskilling and developing quality and capacity within primary care. The team were involved in many areas of work, and Joe's going to give some examples of some of these. But in summary from me, the team are amazing with an enormous range of skills, expertise, leadership qualities, and they are exceptional role models. They are innovative and not afraid to think radically. They regularly come up with fresh ideas around how patients can be managed. So over to Jo. Thank you.
Thank you, Rachel. Hi, I'm Jo Watson and I currently lead the Primary Care Development Nurse team. The feelings generated by receiving the award within the team are displayed behind me, and it was a great morale booster, particularly during COVID. So the Primary Care Development team are a team of experienced nurses. They're highly skilled and knowledgeable, particularly in the management of a wide range of long-term conditions. We have a vision, and this is excellent quality care for all. Rachel's explained out the role of the team and our main areas of work, although this is not exhaustive. We are quite modest, and we've been described as the CCG's best kept secret. Some examples of work that we've undertaken have been the NHS England Diabetes 3 Treatment Target Project. This showed significant improvement in patient outcomes and working with practice-based staff. Been involved in personalisation work to embed the principles of person-centred approaches. We've led on the General Practice Nurse and Healthcare Assistant Awards. We helped set up the staff swabbing service during COVID, and we've supported the COVID vaccination programme. And we've also helped develop guidance for recommencement of spirometry in primary care, and this has been shared right across South Yorkshire and Bassetlaw. Looking to the future, we see as an exciting opportunity. This model benefits. It's a team that's dedicated to improving quality of care for patients, and it's difficult to see how, without such a team, many of the national and local programmes and projects will be achieved. We provide that connection across many stakeholders involved in patient care. We provide clinical expertise and experience into projects, commissioners, into quality assurance, to name but a few areas, and to achieve our vision and improve care for all. We're groundbreaking, pioneering in quality improvement, and known for our brilliance, expertise, leadership and innovative ways of working. Thank you.
Brilliant. Thank you, Rachel. Thank you, Joanne. Our next headline is Improving Health and Life Experience for People Who Live in Care Homes. And I'm going to hand over to Emma Westerdale-Shaw, who's the Senior Quality Manager for Care Homes.
It's okay. Thanks, Kath. So I don't think I need to introduce myself after you've swiftly moved into it. So thank you very much for that. So I just wanted to take the opportunity first off to acknowledge the efforts of all of those working in care homes and the tremendous job they've done in such difficult circumstances over the last couple of years or so. I think it's important also to note that the majority of the current quality and care home team came into post, myself included, just in the last 12 months. So this is more of an overview of where we are currently. So the function of the quality and care home team altered during the pandemic, and the main purpose of the team was to support the citywide COVID response. Since the 1st of April 2022, the team has reverted to its core business of monitoring quality within care homes. Routine visiting was suspended at the start of the pandemic, and whilst this has since resumed, led by the local authority, it remains a challenge due to ongoing outbreaks. The delay in being able to maintain accurate intelligence on care settings has since led to a small number of homes identified as requiring enhanced monitoring. They have been placed into the local authority and the CCG's joint escalation process, which provides an increased level of monitoring, support to complete and sustain action plans, and access to specialists where areas of need have been identified. The Quality in Care Home team work closely with dietetics, medication optimisation, and teams that provide in-house training on clinical skills. Those settings, which are currently within the process, are showing clear signs of improvement and are appreciative of the additional support and resource provision. We are also in a position to offer additional support to homes that are not formally in the process, but it is recognised increased support would prompt favourable results. One of the fundamental goals of the Quality in Care Home team is to improve outcomes for individuals living in the care home sector. There are a number of ways in which we aim to achieve this. Training and education, working with partners such as the ECHO project at St Luke's to enable providers to identify educational needs and address these gaps accordingly. Intelligence and surveillance, maintain our strong links with local authority and partnering organisations and move from a reactive approach a more proactive way of working through information sharing. Quality improvement and innovation. Our dedicated quality improvement manager who joins us in the summer will lead on a range of projects and work streams which will identify areas where support is needed and drive improvement. Wider partnership working, supporting existing work streams such as work around falls with Yorkshire Ambulance Service and the newly emerging project team who are developing the local response to the Enhanced Health in Care Homes framework. Finally, the IPC team at Sheffield CCG have launched a new audit tool for care homes. This electronically based tool will enable an efficient process of auditing infection control, and as an interactive app, the providers will take ownership of completing and evidencing any recommended actions and allow the IPC team to review progress and generate data. This has been piloted in 4 homes with encouraging results, and the aim will be to roll this out across the city to 111 homes over the next 12 months. There is some promising work to take place in the care home sector as we strive to support providers in the recovery from the last 2 years and focus on improving standards, safety and quality of life for care home residents. Thank you.
Thank you very much, Emma. So our final headline for today is investment in the voluntary sector. And for this item, we have Richard Kennedy, Engagement Manager. We have James Sutherland, the Head of Commissioning, Mental Health, Learning Disabilities, Autism and Dementia. And then we have a guest from outside of the CCG, Halima Mohammed, who's the chairperson for the African Women's Health Group.
Many thanks, Kath, and good afternoon, everyone, and thank you for the opportunity to the governing body and to the public viewing for the chance to showcase. There have been so many VCSE developments that have been led by the CCG, and it's amazing to see so many of these within the annual report that was discussed and approved earlier within this meeting. But to give a flavour, over the past 12 months, we as a CCG have continued to develop positive relationships with our VCSE partners. As a CCG, we have listened and we've responded to the voluntary sector, giving longer, more sustainable contracts, developing procurement processes that are more conducive to VCSE organisations, and also supporting our partners to view the voluntary sector as an equal partner in the delivery of care support and treatment. In the past 12 months, over £800,000 of funding has been given to VCSE organisations relating to mental health. In December last year, a further £300,000 was given to VCSE organisations to support winter pressures, which covered hospital discharges, primary care support, social care support, mental health, and many more wider support activities. From those winter pressures alone, 19 VCSE organisations in Sheffield benefited from funding, which provided support, additional support to over 2,000 people in Sheffield in that time period alone. I'll hand over to Richard now, who will share some further information relating to VCSE working and engagement. But thank you all.
Cheers, James. So last year, the CCG governing body committed to focusing our commissioning on people impacted by homelessness, people from Black and minority ethnic communities, and those in areas of highest deprivation. So as a result, we focused our approach to community involvement on how we make that vision a reality, allowing the voice of some of our most marginalised communities to be heard and influence our commissioning. So whilst relationships between the CCG and the voluntary and community sector have strengthened and developed in recent years, COVID brought about a tangible shift in understanding and development of trust. And the dialogue between us has become much more honest. And a key frustration that community leaders shared with us was that a lack of coordination from statutory organisations when we work with them. So in response to this, we've tried a new approach where we've bundled together several CCG priorities into one request of the VCF sector. And community leaders were then trusted that they knew the most appropriate and effective ways to undertake the work and could deliver within the timeframes and the budget outlined. And they absolutely delivered. And the approach has allowed for a devolution of power and therefore a sort of genuine co-production approach to how we've done that. So across the year, we've invested over £400,000 in 27 local voluntary and community organisations to reach out and listen to their communities about some of our key priorities and commissioning intentions. And not only does this approach to our public involvement mean that we're able to hear the voice of seldom heard groups, but the funding directly filters into our communities, including some of the most deprived areas in the country. It's providing employment for local people, additional services, and a more sustainable voluntary and community sector. I'm privileged to be able to introduce Halima Mohammed, who's the chair of the African Women's Health Group. They're with one of the organisations that we've been working with closely for the last few years now. And she's going to tell you a little bit more about the amazing work that they do.
Yes, hello everybody. I would like to introduce to you myself. My name is Halima Mohammed and I work for the African Women's Health Group in Darnall. And we have been in the communities for the past 30 years. And our main provide that we give in the community is we do training skills, and we also we run education, training, and health and well-being courses as well. Throughout the years, I mean, we were completely isolated from the, the institution and big organization in Sheffield. Although we were in the community, engagement was never, really connecting communities like myself. So when the pandemic happened, a lot of things really changed as an organization and community workers. The first thing that really changed the way we, engage with other organizations was the beauty of, being on Zoom. Zoom was the one link that made us possible to engage with so many organizations and institutions in Sheffield. And it was the most amazing, approach that we as an organization got to be able to engage with so many communities, organizations, and, and CCG was one of them. And working with the CCG throughout these years was fantastic because we've learned so much. And the work we did with them was, the outreach work and through the pandemic, how to make the community safe, how to work with the, with the rules and regulations, which every day was keep changing, like keeping safe, self-isolation, wearing your masks, and, all this outreach work was really, really important. And we could fit in with the community. And these are the women and families who are very hard to reach. And English is not their first language. So being able to, help them to understand what was going on was really important. And if we did not, engage with them at that time, I don't know what people would have done. It was really, really appreciated, the work that, went on throughout the 2 years that pandemic was happening. At the same time, what we realized is the simplicity of the questionnaires which was sent to us. Because if sometimes you get questionnaire that you don't even understand what they're asking you, and from people coming from ethnic minorities whose English is not their first language, to understand that survey was really important, that they understood what was in that survey. So the CCG helped us even when we decided to have a paper form survey, so that the women, we could sit down with them and read to them and make them understand what those questions were asking. And that gave them the, the opportunity for their voices to be heard, because of their survey went to what they really was important to them. And most of the time, you know, their voices are not heard. We never ever had input like we've just done within these few years. And it was amazing that, you know, we could be in touch, we could engage, we could get their voices heard. And we did say that, you know, we have done so much work with the CCG. I'm sure they're going to make some changes with what has, you know, people have been saying throughout those surveys. So we really appreciate and, you know, got the opportunity to work with the CCG and many other organizations in Sheffield, you know, really fantastic working with them.
Thank you so much, Halima, and thanks to Richard and James.
Thank you.
And thank you to all our presenters for coming on today and sharing the highlights of their work and the achievements over the last year and the previous years. There were so many more that could have come today, and there's lots more examples, but it was great to have the people we've had today. There you can see in the annual report, there's a link through to all our previous annual reports. So over the last 9 years, there's a lot that we've achieved and are very proud of. So thank you, Terry, and back to you.
Okay, so thank you, Kath, and thanks for everybody that's presented their stories there. I do recognise that we're just reaching 3 o'clock, but if those of you that have come to present your stories just want to stay for a few moments longer, I'm just going to change the agenda order slightly again at this point. Those stories that we've heard there are incredibly powerful, and I think they really show some of the impact that our teams working with local communities and with partners have had over the last year and over many years beyond that. And it is kind of, it's inspiring, and I think it makes us all feel proud of what the CCGs have achieved, particularly as we now hand over the baton to the ICB from July. So we really hope that some of those powerful stories we've heard today, as we hand that over, will be picked up and will be built upon. So as I say, I'm just going to say a couple of words, and I think as we've got hands coming up now, it would be really nice if we could do our usual governing body reflections as the final bit, and then close the meeting at that stage. So from me, I just want to say thank you to all governing body members for your support, enthusiasm, the relationships you've built, and absolutely the values that you've carried through over the last couple of years, I think have been really important. I cannot let the meeting finish without saying thank you to our corporate secretariats. So I know we've got Karen on the call, but also Carol, who's not been able to join us, because without them, none of these meetings would be possible. I think we would be in a pickle, and they do such a good job in the corporate secretariat and in the business management team of keeping this machine well oiled. So big thanks for that there. And as I said, we've got the hands coming up now, and it seems sort of a good point would be to hear reflections from governing body in relation to the stories we've heard, and any other reflections that you wish to share. So over to you. So Amir first, please.
Thank you, Chair. I do need to get away in a few minutes, but it was actually a couple of reflections listening to this. I can't help but agree how inspiring it's all been. And then a plea to Gavin. The first thing is we've achieved a lot, and we've achieved it across the board through local relationships. I had jotted down, you know, frontline clinicians and CCG colleagues, as well as a myriad of other organizations, and listening to the other teams, that's just been a running theme. I heard Gavin say he would not disinvest in health inequalities. It would have been nice to have heard invest in health inequalities, because if the last 2 years, 2.5 years have shown is the huge gap, and how you know, we can use words like health inequalities and digital poverty, etc., but to actually see it on the front line is just something else. I would also kind of make a plea to Gavin that there is a huge legacy left. I'm left with staff, as I'm sure it's everybody else across the board, who are absolutely exhausted. And guess what? Remember the old Jaws film, just when you thought it was over? I think I sent my first case of monkeypox in today, monkeypox rather. So back to make sure you're isolated, make sure you've got your PPE in, etc., etc. So it's an ever ongoing thing. My plea to you, Gavin, is when we go to place, please do not destroy or harm the local relationships that we've built up, particularly over the last couple of years, because of the adversity. Adversity makes us all come together. As we distance from the front line, I mean, I have always kind of seen myself as a frontline representative on the CCG. But the further we get away from that front line, the less people tend to hear. So, you know, I think we need to ensure that those relationships at place remain, because that's when we achieve the most, as you've just heard. Thank you.
Thank you, Amir. I'm going to bring Lucy in because Lucy is trying to put her hand up, but she's not able to. So, Lucy, do you want to just share your words with us?
Yeah, I just put in the chat. So obviously I want to say well done to Richard and the team, because it really has been brilliant work over the last couple of years, and we have shifted how we engage with the population and said, you know, really put the investment into, you know, into those with the greatest health needs. But also, you know, I'm just really proud to work for an organisation that's prioritised. I mean, James's work has been brilliant, and there are examples, you know, across the organisation where we really have put a load of investment into the voluntary community sector. And a while ago, I looked into it, and there is some target about, you know, a certain percentage that NHS organisations should put into the voluntary community sector. And I think we're well ahead of lots of other organisations, and I think we should be really proud of that. Definitely more to do, but yeah, definitely a big round of applause to James and Richard and the wider team. So thank you very much.
Thank you, Lucy. Chris, please. We've got you on mute. Do you want to just unmute, Chris?
I'm Chris Nield. I am a lay member on the governing body and I chair the Primary Care Commissioning Group. But I'm also a public health consultant, and so I've seen through the CCG and also through the public health team some of the really urgent issues, but also that innovation and that relationship with communities, respect for communities, and how working together on that has made a huge difference. It's made a huge difference to the vaccination programs and a huge difference to taking forward our priorities on health inequalities. There's been strong relationships between communities and primary care and the voluntary sector for quite a few years, but I think the proactive approach from Lucy's team in partnership with the local authority and primary care and the voluntary sector, that has been huge over the last 2 years, and you can see the difference it has made. You can see the difference in outcomes. So that's really important for me, and to see those things being put into action. I also think that procurement, sometimes it's very tricky in order to put that resource in the voluntary sector where we've got the local links, we get more bang for our buck, we get people that can access the voluntary sector more. So just wanted to particularly find procurement in the CCG, procurement and finance, and also in the local authorities. Perhaps we don't necessarily see that, but certainly some of the ways we've taken that forward. You can commission for this, and you can help by identifying risks and looking at gaps and implementing good practice. So I'm very proud of being involved in the CCG as a lay member through this time, and like to thank everybody involved.
Thank you, Chris. Mark, please.
Yeah, a couple of things. I think we've made one of the things you talked about the last couple of years, Terry, and I think you're probably referring particularly to the pandemic, But I think as an organisation, we have really shifted in the last 3 or 4 years after a very difficult time for us. When as an organisation culturally, we weren't working in the way that we should have been working. And just a couple of things, which I think shows our strengths. The first is, and Michelle, you sort of, I'm going to use the example because I think it's really important that we can be honest about when things are not working properly, and that we can say that in public meetings like this. And that's not to sort of say, oh, things are terrible, but then to say what we've done about it. And I think because that's our responsibility as the custodians of public money and with responsible for health and well-being. So that sort of strength to actually be honest about saying things are not working in public meetings is something that I really welcome, and we're comfortable with that. I don't think anyone felt uncomfortable when Michelle was talking. Other people have referred to things too. But the second cultural change that I think I feel have hugely shifted over the last few years is we've recognized that it's all very well people sitting on governing bodies at the top of organizations, but that's not where the really creative and hard work is happening. It's happening for want of a better word, at a middle management level in organizations and on the front line. And we've heard examples today where people have talked about the creative, strategic actions that they have taken forward, working in partnership with others, in particular the voluntary and community sector. And that comfort that I think we've created culturally as an organisation to enable that, and it was, say, a wake-up call that enabled us to shift and actually recognise that that's where the creative, skillful work is happening, not just among the leaders, is I think a tremendous legacy, and one that I'm sure will continue. So I just want to celebrate those two things. Thank you.
Thank you, Mark. Marion, I note that you've popped a brief bit in the chat, but do you want to pop your mic on and tell us what you've put there?
Thank you. I thought we might not have time. I think it's been great. I think we've had leadership from the top, and we've communicated the new messages as they've come thick and fast all the way right down to the grassroots and us on the front line in primary care. I think it's been absolutely great. As a city, I think we have reached the parts that are difficult to reach. The SEND, we've heard about intravenous drug users. Sheffield's done it. Don't know how, but well done, boys and girls. We've done it, and it's measurable. The evidence is there that we've done it. So we've got a really good track record. We've got a lot to be proud of, and we've got a lot to build on. So when it goes from where we are now to where we're going, we can be very proud of ourselves. So well done, that team.
Thank you, Marion. Lisa, please.
Okay. Hi, I'm Lisa Phillip. I'm one of the GPs on governing body, and I just want to echo what everyone else has said. It always helps me to hear stories when people come back and share them, because it reminds us why we're doing what we do. And I'd just like to thank everyone that came and shared their stories, and thank Halima especially for coming from the outside. I think I recognise Halima from the Black and minority ethnic public health group, which was set up during COVID, so that all of those groups have a voice. I think that we've done so much collaborative working, and it's made a really big difference. And I've worked on both sides of the fence, so I can see the difference that it's made in those communities, that their voices are really heard. And I think we've fostered some really good relationships. So I hope that we can sustain them going forward. But thank you to everyone.
Thank you. Lee, please.
Thanks. Yeah, just thanks to everybody. Everybody's worked amazingly well, and we've learned such a huge amount, haven't we? I suppose there's just one word that I want to pick up on that Richard mentioned. I sit on SPEAK, which is the Patient Experience, Equalities and lots of other things committee, but really it's about actually, are people being heard? And are we getting the services right for what people need? And Richard and his team have done an amazing job. But one thing he just mentioned in this presentation was the word power and shifting power. And I think if we talk about culture, that's one thing that we've learned, is that, you know, we shift power from big organisations to communities and grassroots and where it's really needed. And again, listening to Halima's fantastic presentation, that sense that she was talking to ladies who've never fed into services before, have never had that experience of having their voice heard. And my hope is that we've sort of empowered them to speak up, you know, and to have that expectation that of course they should be heard, because that's a shift of power dynamics and power balances. So going forward into the new landscape, my hope would be that we understand the benefits of shifting power and disseminating it across the board, so that actually we can really enable communities to have their voice heard and to shape the services that they need.
Thank you, Lee. Anthea, please.
Obviously thanking everybody who's spoken today and those who've taken it out of their comfort zone a little bit as well. I just wanted to reflect on when I came to Sheffield 3 and a bit years ago. And I just remember through the first meetings, probably my first interview, which I've blanked out, about how the focus on inequalities and improving inequalities was like being hit by a freight train. It wasn't something that I had experienced before, how many people were just focused on doing everything they could to do it. And I don't think we've just sustained that over the 3 years with COVID, but I think we've really improved that and really challenged ourselves to go further and get there. It's not a journey that we've completed yet, and we're still going, but things are really different in Sheffield, even from where they were 3 years ago when they were different from everywhere else. And I think we all need to reflect on that, thank our teams, make sure that the teams below the teams presenting today all really know how we appreciate that, how we feel for that, and hope that it continues into the future.
Okay, thank you, Anthea. Does anybody else have any final thoughts or reflections they wish to share? I think we've heard a real variety. I think they're excellent reflections on the annual report, and in particular, some really good reflections on the journey that we've been on over the past 9 years. So a couple of hands coming up, Chris and then Gavin, please.
I wanted to thank you, Terry, for chairing of the CCG, and it's been really, we couldn't have thought anything like this was going to happen. And as been noted, we were at a tricky time as you took over, and your leadership has been excellent. I think I mentioned before, you've got such an appetite for learning and development and applying and looking at what works. That's really inspired a lot of staff. And also personal support when it's been really difficult times for individuals and teams. So just thank you for that. It's made a big difference.
Thank you, Chris. Gavin, please.
Thanks, Terry. It was just as I'm just conscious that there were one or two comments sort of directed in my direction as a sort of baton pass from the CCG to the ICB. So I just wanted to say that I'm listening. I heard that, and I don't think I've ever said this before, but I actually thought your annual report was a great read, and you look at some of the examples of the things that have been achieved, particularly in relation to some of the examples around VCSE, for example, and the relationship between I guess the formal NHS and the voluntary sector, and the things that can achieve for actually quite modest investment, I think is incredibly powerful. So I think it's really just to say that my sense is, Sheffield CCG has built some incredible foundations. The work won't stop; it will carry on. And I think what you've achieved in the past puts us in a great position to build on that and move forward. So I'm really looking forward, in the kind of new world, to working with many of the colleagues that are on this call today in taking it forward from the 1st of July. So just a real privilege to be here and listen to some of the stories, and obviously receive that challenge from some colleagues as well.
Okay, thank you, Gavin. So I think that now brings us to closure of the meeting. As mentioned at the beginning of the call, if there is any further urgent business the CCG needs to pick up we do provisionally have a slot on the 30th of June. Otherwise, you'll be hearing in due course about the CCG's CCG, I'm getting my acronyms muddled up there. The ICB's first meeting in public on the 1st of July to pick up where we've left off. So thank you to everybody that's joined us this afternoon, particularly members of staff from across the teams. Really special thank you to Halima for joining us. I know it can be a really tough and intimidating thing to come and talk to a board, but your story this afternoon has been really powerful and really welcome. So thank you for joining us.
Thank you.
Okay. Other than that, I'll bring the meeting to a close. Thank you, everybody, and we'll see you in the future.